That they have their whole lives almost always felt like, even times when they were toddlers and their parents will come in and talk about, I couldn't get a dress on her to save her life, and she was 2. She hated it. Or this, my little son has never wanted to play with toys. He wanted Barbie dolls. The sweetest gave up and broke his dad's heart. And coming to the teen years, and they're telling us, I don't feel like this is my right body. Something was wrong. They spend a lot of time. I have a lot of the teenagers that I have met with this. They come in with the questions about wanting to know if perhaps their parents had a choice at birth, a specific condition where perhaps they were born with both genitalia and the parents chose the wrong one, because when the surgeons get to correct it, and that almost never is the case. So gender identity is where they feel like they are in the wrong body. And interestingly enough, as a separate topic, like if a woman comes in and she feels like she's a man and she's interested in a woman, she does not consider herself a lesbian.
That's correct.
She considers herself straight. She's just in the wrong body, and frequently go for sex reassignment surgery, which is a lengthy and painful process, and the insurance companies make it very difficult for them to qualify for it. And I think it's even still listed among the psychiatric disorders, which makes it even harder for them to get treatments.
Gender identity disorder, yes, it's a psychiatric disorder.
Something to look for, particularly with bulimia, but also with the binge purge type of anorexia, this is like the telltale sign. This is when they think that I'm like some sort of genius, but I look at their hands, I look at their nails, and I look at their knuckles, and there's frequently abrasions from them gagging themselves, because their teeth, they have like a natural response where they clamp down, they push their hands so far back into they're scraping their knuckles on their teeth, and from the acids. Then frequently their nails are very brittle, as well. But from their purging, and their body adapts. Their body stops letting them get sick. After a certain point in time, they have to put more and more effort into it for many people. Unfortunately, some people develop a very easy gag reflex where they just have to think about it and get sick. But there's many a person that I've treated that they can't get sick, and so they have to go through extreme measures to do so. Okay. Essentially, most of the criteria that you could look for binge eating disordered folks really would have to do the rapid weight gain, and eating at inappropriate or unusual times, large amounts of food missing, a lot of hoarding of food, although that happens with bulimics as well. Actually, anorexics occasionally do it as a control factor. They will buy or grab boxes of Twinkies and keep it in the room just to see if they can have the temptation and not do it. But for the most part, hoarding behavior actually has to do more with bulimia and those sort of things. So if you know someone who's hoarding a great deal of food, then it's something to pay attention to. So. A couple of last things that I wanted to go into is things to pay attention to as parents, as family members or friends with individuals that may or may not be struggling with these issues. As a general rule, things that I'm talking to with parents of young children, at some point I have a conversation about, do you have any idea how much you talk about your body image in day-to-day conversation? And I'm going to admit, I feel like a hypocrite sitting up here because I just had a baby 11 weeks ago, and I'm complaining about nothing fits. And it makes me look fat, or I can't fit into that one. These are my fat clothes. And that's not good. I got a 3-year-old child who's absorbing it, a 3-year-old daughter, no less, who's absorbing it. So we have to pay attention to those kind of things. But what I encourage parents to do when they want to know, how do I avoid this? Or it runs in our family, or I struggled with this as a child, or I really could have had a problem if I hadn't have gotten help for it. How do I stop this from my daughter or my granddaughter from developing these symptoms? And one of the things that I encourage them most is to pay attention to their language. What are they talking to their children about? Because it's really about, the best gift you can give your child is self-esteem. The best thing, the best parenting tool that you can give them to help them recover and survive from just about anything is a good sense of self-confidence and what we call self-efficacy, which is a belief that they can take care of themselves, and a sense of self-esteem. That's the number one thing that any parent can do. And I think we lose focus of that so much in our world with getting involved in sports and having to be almost always two-parent working homes. And remember that exercise that we strongly encourage to do as a family is for the purpose of being healthy and keep taking care of our heart and our body, not necessarily for losing weight, because that's then setting them up to look at exercise as a weight issue. We want to talk about, they actually recommend not labeling good and bad foods. Like really fatty foods, this is a bad food. Don't eat this, because they don't want to start thinking about, well, if I eat fatty foods, I'm going to be fat, I'm going to be bad. That's the connection that they make subconsciously with that. And unless your pediatrician tells you to pay attention to your child's caloric intake, let their hunger dictate what they eat for the most part, or at least how much they eat. I should say what they eat, but I think no, my 3-year-old no. She would spend all day eating candy and those darn little sugary treats at Walmart that are always up front. So you do have to pay attention to what they eat to a certain extent, but really the amount of what they eat, unless you have a pediatrician telling you that they are having unhealthy weight gain, or they're already overweight, or there's a genetic condition that you need to pay attention to, let their hunger dictate it. And then encourage activity as a family. We do encourage meals together as a family, where you just talk about life and reconnect over food. And so it's not as much of an issue where they can go into their room or avoid meals altogether. When people come in to my office, by the time they've reached that level of, there clearly is a problem, and I often find that there's a family member that is just too involved. Usually it involves treating the whole family collectively, and oftentimes it does involve treating that parent, them receiving their own therapy to address perhaps what the need is that is becoming so intensive a relationship with their child. So those are the primary things to look for when people say, what can we do to stop this? Fathers have an enormous role in their daughter's world, and their daughter's world of self-image, especially as a woman. And I think that gets missed a lot in families. Fathers get very uncomfortable when girls start reaching closer to the teenage years, and they start wearing bathing suits, especially if they start looking good in bathing suits. It really disturbs fathers, and they avoid it. They don't want to talk about it. They don't want to be around their children when they're wearing bathing suits, or where exercise is involved a lot of times when they've reached that point in time in their life. And it's actually we're attributing some of the decline in self-esteem for women with the disconnect with their fathers in our culture too. And so that's another thing. I guess another factor when we talk about prevalence and what does this look like, pretty much in every industrialized country, the rates are pretty similar. For the statistics about what people, it's probably a little bit worse in America, just like everything else seems to be when you look it up. But just about in every industrialized nation, so every nation that we would consider sort of comparable to us. And in the developing nations, we're seeing more. The more influence that there is becoming of the Western culture into their world, the more it's happening. And we can attribute it to any number of things if we want to, but the reality, a lot of it comes back to self-esteem, with conflict frequently in families, emotional restriction, and our media, which I could spend all day talking about that, but it's 8 o'clock, so I will stop. But our media is not helpful. It is not helpful. And it is very unrealistic what so many of these people in the media look like. And when you talk about the model, what was the recent one? Tyra Banks. Is that who I'm thinking of? You know, she has her own talk show, I think, right? Yeah. I mean, she got up to a size 8, heaven forbid, and the media was just all over her. I thought she looked great, you know, and she got up there and talked about how great she felt and was comfortable with it, and I thought that was one of the best things that could possibly be done for it, because in years past, she would have probably just disappeared until she lost the weight. That's what her manager would have told her to do. That's what her world would have told us to do. As a separate aside, one other thing that's sort of coming up in treatment for eating disorders is that if you look at a lot of the research, there is a lot of support for comparing eating disorders, particularly anorexia, with addiction treatment, because there's very much sort of a reward cycle system that we think that works in the brain, and it kind of makes some sense. And as a result of that, there is recently developed in Indianapolis a 12-step program that focuses now on eating disorder. And a lot of the literature talks about when you're talking with your family about these substance abuse, that they kind of support talking about using food in that way. And the family's not using food as a reward or a punishment. And how often do we do that? Myself included, Circus Peanut. I rewarded my child for peeing on the body today. Man, I'm getting ready to go to do a talk about it, and I just did it. I rewarded her for good behavior. And candy, no less. I should have taken her for a walk, which she probably would have loved a great deal more. But it required time and effort on my part. And I think that was where I failed as a parent. And it's just a little thing, but it's something to pay attention to. And it's easier to do so many things that aren't healthy. We need to sort of take back that initiative in our own lives. But the best thing you can do is to teach your children about self-respect, self-esteem, talk with them about loving yourself and accepting people and not basing it on appearance, and doing the same darn thing yourself, because if you are not a good model, I know. Kids know a lie when they hear it. They have really good noses.